Today we are going to talk about the care, the gynecological care which we need to take in elderly women. We all know that age is just a number. So, there are people who are hale and healthy even at the age of 60, although we call them as senior citizens. It is very, very important that each and everyone takes care of their health, because in women we see there is lots of hormonal disturbances when a woman sets in her step into the age of 45 and above, because the menopausal age in women now is considered as 47 to 51 years of age. But 10 years before that and 10 years after that, there will be lots of hormonal disturbances which a woman could undergo. So, it is very, very important at that age that a person is taking care of her health and having proper gynecological checkups also. So, it does not mean that a woman at that age group should have only gynec problems only. It could be problems related to her health, because she is 50 and above, and she could have hypertension, she could have diabetes mellitus, she could have thyroid issues also, commonly hypothyroidism and such issues. So, it is very, very important that a woman has to take care of all these things as age advances to have a very good healthy life into her say 60s and 70s, because age expectancy, that is the expectancy of the age in women, earlier days used to be like close to 50 years and 55 years, but then now we see that women live up till 80 years. So, it is very, very important that they have a very healthy life, both psychologically, physically also they will be fit, and they are important to have a very productive life even at that age. So, it is important that they have to take care of their medical fitness. The diet is very, very important, and it is very important that they have to exercise very well on a regular basis. Whatever is possible, they have to go for a regular walk, have healthy lifestyle in their places where they live. It is very important to have psychologically a very balanced life also. So, it is very important that the family members also are very supportive to the women at that age. So, coming to the common gynec issues which a woman could undergo at this age group is because of the menopausal changes, because a woman could go into menopause as early as 42, 43 years also, or as late as up till 52 years also. So, when there is a change in her, like going into menopause, she will have lots of psychological issues. She will have like issues related to her periods becoming very irregular, or sometimes heavy flow, or sometimes the flow is being very, very irregular also. And if there are, on the top of it, if there is any diseases concerned with the uterus, like fibroids in the uterus or some polyps, she might have excessive bleeding also during the periods. Other problems in the genital tract or related to her uterus and ovaries could be the ovarian cysts, which could become malignant cysts when she is going above the 60th year. In her 6th decade and 7th decade, we have seen people developing ovarian cancers also. The very common diseases which we come across and which we want them to get screened very commonly is breast diseases. So, it is very important a woman should know about how to do the self examination for herself, and probably follow up with a mammogram. If there is a strong family history of breast cancers, they have to have mammograms done also, or a scan, sonomammogram at least has to be done, and a regular scan for the uterus and ovaries to see if there is any diseases of the uterus like fibroids or polyps or ovarian cyst also. And when coming to the uterus, more important thing is the regular screening of the cervix, that is the lowermost portion of the uterus where malignancy can occur. So, there is a very easy and a common test which we are doing or offering everyone, which we call as pap smear, which is very important to find out if there is any cervical cancer or any abnormality which can go into cervical cancer. So, it is very important at this age that everyone has to get screened for their diseases, not only the gynec diseases, but even the medical diseases which were very common at this age group, which can be treated when detected, like as in diabetes mellitus, hypertension, hypothyroid, and other social issues also to be addressed, like depression. A woman should be going through lots of phases in her life because her husband is aging. In our society, the children are educating or moving away from her. So, there is lots of problems like related to her psychiatric condition also. So, it is important that a woman has to be completely or thoroughly screened on various issues when they come to the clinic, or probably when they have their medical checkups, they have to have all these issues to be sorted out. It could be even in case of dementia, like after certain age, most of the people can go through these things like dementia, they'll lose memory very quickly. So, those things also has to be addressed. Thank you.